I'm Dr. David Barold, and on this channel we cover ECG basics and how to avoid common diagnostic ECG errors. In this video, which is the final part of this series, we will go over 7 ECG practice strips to test your acquired knowledge from part 1. We will show each ECG for a few seconds before providing the answer. Let's get to it. ECG number 1 was recorded at the bottom of the heart. Lead 2. Is sinus rhythm present? Yes, sinus rhythm is present because the P waves are positive or upright, but there is slight irregularity in the sinus rate. This is called sinus arrhythmia and is normal. This is where the heart rate increases during inspiration, and this is where the heart rate slows during expiration. ECG number 2 is a 12-lead recording. Is sinus rhythm present? Yes, the P waves are positive or upright at the bottom of the heart, lead 2, and negative or inverted at the top of the heart, lead AVR. This indicates that the rhythm comes from the sinoatrial node. Note that the heart rate is 110 to 115 beats per minute, and this is called sinus tachycardia. ECG number 3 was recorded at the bottom of the heart, lead 2. Is sinus rhythm present? No, a sinus rhythm is not present because the P waves in the lead at the bottom of the heart, lead 2, are negative and inverted. Sinus rhythm is indicated by positive or upright P waves at the bottom of the heart, lead 2, and negative or inverted P waves at the top of the heart, lead AVR. There is an easy way to remember what these leads represent. You can use A for above and R for right. Lead 2 is at the exact opposite, bottom and left. ECG number 4 was recorded at the bottom of the heart, lead 2. Is sinus rhythm present? This is not sinus rhythm. In this ECG, the P waves are inverted or negative and follow the QRS complexes. The P waves originate from the bottom of the atria instead of the SA node at the top. It shows that P waves can sometimes follow the QRS complexes. This is an abnormal ECG. ECG number 5 was recorded at the bottom of the heart, lead 2. Is sinus rhythm present? Yes, sinus rhythm is present because the P waves are positive or upright. Note that the heart rate is less than 60, and this is sinus bradycardia. As a sideline, note the notching of the P waves that suggests abnormal conduction within the atria. The QRS complexes are wide, suggesting abnormal intraventricular conduction. This ECG exemplifies the concept that sinus rhythm can be present in an abnormal electrocardiogram. ECG number 6 was recorded at the bottom of the heart, lead 2. Is sinus rhythm present? There is marked irregularity of the rhythm, and some of the P waves are not followed by a QRS complex. We can say that some of the P waves are blocked. Nevertheless, there is normal sinus rhythm, again because this is a recording from the bottom of the heart, which is lead 2, showing positive or upright P waves. Remember that sinus rhythm can be present even though the relationship between the P wave and the QRS complex is not constant. ECG number 7 was recorded at the bottom of the heart, lead 2. Is sinus rhythm present? Yes. Regular sinus rhythm is present, but it is sinus tachycardia. The atrial rate shown with blue arrows is regular and 105 to 110 beats per minute, which is faster than the regular ventricular rate shown with red arrows, which is 40 to 50 beats per minute. The blue dashed arrows represent P waves, which are hidden inside the QRS complexes. There is no relationship between the P waves and the QRS complexes. None of the P waves are transmitted to the ventricles. The P waves are blocked. This is why this is called complete atrioventricular block or complete AV block. Looking back at the previous ECG, you now know that AV block can be partial or complete. This ECG also exemplifies the concept that sinus rhythm can be present in an abnormal ECG. This wraps up the last video of this two-part series. I hope these videos on sinus rhythm served your learning process. Drop a question or comment below and be sure to subscribe and click the bell icon to be notified of my next video release.